Welcome to Afro Mosaic Series 15. We're in Barbados, looking at a health crisis driven by non-communicable diseases, or NCDs. The greatest threats to human life don't always announce themselves. They don't start with a fever, a cough, or sudden pain. They begin in total silence. In a nation famous for its vibrant life and stunning landscapes, a staggering 83% of all deaths are linked to these non-communicable diseases. 1 in 3 adults here is walking around with hypertension. Over a quarter have raised blood glucose. Most of them have no idea their bodies are already under siege. That is why health officials are making prevention an absolute priority. A population can look perfectly healthy, go to work every day, and feel entirely fine, while harboring a massive, invisible, and lethal health crisis beneath the surface. When disease rates climb this high across an entire population, we have to look past individual choices. This epidemic is a matter of systemic design. Over decades, the local food system shifted. Instead of relying on domestic agriculture, the island became heavily dependent on goods arriving through its shipping ports. That heavy reliance on imports created a stark economic reality. Highly processed foods packed with salt, fat, and sugar became the cheapest, most accessible options on the shelf, and an acquired taste for generations. At the same time, the way people work and move changed. Modern labor markets and urban layouts engineered daily physical activity right out of the average routine. In 2015, the government implemented a 10% tax on all sugar-sweetened beverages, but the crisis demanded a stronger counterattack. In April 2022, they doubled the rate to 20% to drive down consumption of liquid sugar. The environment itself has been quietly engineered to make people sick. The infrastructure surrounding daily life makes illness the path of least resistance. Because the system builds these conditions silently over decades, the physical consequences eventually strike families out of nowhere. This visualization breaks down the acute emergencies from just 1 year. In 2022 alone, Barbados recorded 556 heart attacks and 765 strokes. Every one of those numbers represents a family thrown into chaos. These sudden health events leave empty chairs at dinner tables, steal grandparents too soon, and push households into deep financial ruin. The economic strain on the nation is massive. Treating these diseases costs Barbados up to $825 million every single year. That is nearly 10% of the country's entire gross domestic product. The epidemic may start in total silence, but it ultimately demands a devastating toll on both the national economy and the human heart. If the system is rigged and the diseases are invisible, how do everyday people fight back and win? Detection is protection. A simple medical screening strips the disease of its dangerous silence, forcing the threat out into the open where it can be treated. The Diabetes and Hypertension Association of Barbados launched the Know Your Numbers campaign to tackle exactly this. They are urging every citizen to track 3 vital metrics: blood pressure, blood sugar, and cholesterol. Health workers are taking this mission out of the clinics and bringing preventative screenings directly into trusted community spaces, setting up in barbershops, salons, and vibrant outdoor community fairs. Through the Barbados Moves initiative, citizens are also reclaiming their health at the ground level, organizing monthly hikes, community walks, and healthy cooking demonstrations all across the island. Early detection reclaims years that would otherwise be stolen. Don't wait. Don't assume you're perfectly fine. Detect early and live longer. Please like, share, and subscribe to AMHG Magazine, and visit amhg.ca for more stories. Remember, awareness is love in action.